Here we have a geriatric rat under general anesthesia with a skin lump that had been present for some time with an ulcerated surface. It had already been clipped and cleaned with an antiseptic, and here we're just trying to remove the debris and clean out the lesion. You can see that the debris is very thick and caseous like cottage cheese. Pus in this species tends not to be liquid. It doesn't flush or drain very well, so we're digitally and manually removing this. The goal here is to get the internal lining and capsule as clean as possible to reduce infection. Cysts and abscesses in rats and rodents in general are very prone to reoccurrence because the bacteria remains in the lining, and as they start to heal, they wall it off again, and then we end up with another lump. Many of these end up having to have surgical removal to resolve the infection entirely. We do culture these, and a culture allows us to determine what bacteria is present, if any, in the lesion. And then they actually test antibiotics on the various bacteria so that we know what kills the organism and what it's resistant to, so what not to use for an antibiotic. In this image, we're just flushing out the lesion with an antiseptic solution, trying to get this as clean as possible and all of the visible debris removed for the best chance of healing and resolution. And the owners will provide topical wound care as well. Some more debris was seen. This is attached to the lining of the capsule, so we're removing and trying to clean out the lining, and it's being flushed repeatedly until it's as clean as we can get it without surgically removing this entire mass. The rats are very tolerant of this procedure. They're monitored carefully under anesthesia. They are given pain medication as well. Here he's waking up. You can see the squinting and porphyrin staining, which is secondary to the respiratory infection, very common in ratties, often when they're stressed from other things.